Well, from strokes being the leading cause of disability in Canada to the problem of legalizing marijuana for users under the age of 25, plus seasonal allergies and how to know if you have them and what to do about it, here to help us break down some medical headlines with the information you need is Dr. Adam Kassam. Welcome back to Your Morning.
Great to be here.
All right, first of all, June is Stroke Awareness Month. What do you think people need to know when it comes to strokes in Canada?
Right, so strokes are the leading cause of disability and the third leading cause of death in Canada. There are over 60,000 new cases of stroke every year and over 400,000 stroke survivors across Canada. So this is a relatively common disease. We know that the most important thing about strokes is that if we can have patients recognize their symptoms early and get themselves to a hospital, their outcomes are much better, which is why the Heart and Stroke Foundation's awareness campaign is extremely important. So we want folks to remember the acronym FAST. F stands for face, is it droopy? A stands for arm, are they weak? S stands for speech, is it slurred? And T stands for time, call 911, get to the hospital right away.
Something we were talking about this morning a lot, now that we've seen Bill C-45 passed in the Senate, the legal age to use, when to use marijuana. We've been talking a lot about that, especially for people like myself. I have 11-year-old kids at home. I'm going to be raising teenagers in this era of legalized marijuana. What are some of the concerns for anybody under the age of 25 using marijuana?
Right, so the medical community is concerned about recreational use for patients in terms of their access, which will be much more easy moving forward. We know that cannabis is good for certain medical conditions like epilepsy, chronic pain, spasticity, but there are concerns that we don't have enough data for long-term outcomes that we haven't been able to study. And so we know that cannabis can be cognitively impairing. We know that it could potentially have a deleterious effect on the developing brain, which doesn't fully mature until 25 years of age.
Concern for a lot of parents, and often the rebuttal is the fact you treat it just like alcohol. So the legal age for drinking in the province of Ontario, it varies across the country, is 19. And they set it that way because they feel like that's the age people can start to use it responsibly. Is it fair to make the same comparison with marijuana?
I think the comparisons are fair as far as legalization are concerned. I think that, again, we know a lot about alcohol. We know a lot about the bad effects of it chronically, whether it's cirrhosis, cognitive impairment, things like this. But in cannabis use, at least in the medical community, we just don't have enough data. So I think it's important that we be cautious about aggressive use of it moving forward.
This is one that's come up a lot, and that is, how do you know if what you are experiencing right now is a cold or if it's seasonal allergies? And people will often say, well, I don't have any allergies.
Right. So there are a couple of major differences between a cold and allergies. So allergies are the ones that typically present with itchiness. So an itchy eye, itchy nose, itchy throat, and colds typically don't present that way. Colds are also pretty much associated with, or can be associated with, fevers, whereas allergies typically do not. And colds typically have a timeline between 5 and 10 days, whereas, as you were mentioning, seasonal allergies can come around the springtime with ragweed and pollen, and they can typically last even longer than 10 days.
So if you're talking to someone in your office and they seem stuffy and they say, oh, I have a cold, it's quite possibly it's allergies.
It really depends on the type of season, and it certainly could be both, which is why it's important to go see a doctor to kind of have them do a differential diagnosis.
When clients come into your office and say, but doctor, I've never had allergies, I'm a grown-up now, how could I possibly have allergies?
Right. You can develop allergies at any point in your life, just like a drug allergy that can come on later on in life.
Yeah.
Seasonal allergies can happen at any point. Typically, we do find that if you do have allergies, you'll have them when you're younger and have them throughout your life, but people can develop them at any stage.
So do we need to go and get the test at the allergist, the scratch test?
I would say if you're very interested in knowing what exactly you're allergic to, I think that would be a reasonable thing to do. I think symptom treatment and management is usually pretty common sense. Antihistamines, decongestants, things like that can be done sort of at home or with your family doctor.
Cold medications aren't going to be enough.
They can help a little bit with symptoms, so kind of symptom management, but as far as the allergies themselves are concerned, they're a different process in terms of the way that they affect the body.
Okay, so when someone comes into your office and says, this is a cold, and you say this is allergies, it's worth going to get it checked out?
I think so, yeah.
Dr. Kassam, good to have you here. Thanks for coming on to explain some of this for us.